All right, let's jump right in and talk about a true neonatal emergency, hyperammonemia.
So why does a newborn that looked perfectly healthy just a day ago suddenly become critically ill? This is the question that keeps us up at night, right? In this explainer, we're going to tackle one of the scariest answers to that question. We'll build a really practical framework for this high-stakes scenario, something every pediatric resident and neonatal fellow absolutely has to have in their back pocket.
Yeah, this really says it all. Lethargy in a neonate isn't just a symptom. It's a 5-alarm fire. It's that one subtle sign that can signal something absolutely catastrophic is brewing under the surface. Our goal here is to give you a clear path to follow when that alarm bell goes off.
So, let's set the stage. The clock really does start ticking from the very first sign. With hyperammonemia, there is zero time to waste. It's sneaky, and the situation can go from bad to worse in, like, the blink of an eye.
Okay, so how do you even spot this? What are the signs and symptoms that should make your antenna go up? Let's talk about how to move from just vague symptoms to a really high index of suspicion. So you look at this list: poor feeding, lethargy, vomiting, tachypnea. The first thing you're probably thinking is, that could be anything, right? Sepsis, a cardiac problem, you name it. And you're right, these are super nonspecific. But here's the kicker, the big clue, the timing. Usually, this baby was totally fine for the first day or two. Then, often after they've started protein feeds, this sudden crash begins. That timeline is a huge red flag.
And if you don't jump on that initial suspicion, well, things get bad fast. We're talking a rapid slide from a little sleepy to coma, seizures, and worse. This isn't something that unfolds over days. We are literally talking about a matter of hours.
And here's why it's so terrifying. Hyperammonemia isn't just some number on a lab report that's out of whack. Ammonia is a potent neurotoxin. It gets into the brain and causes massive swelling, and it literally excites the neurons to death. So let's be super clear. Every single minute that ammonia level stays high, you are losing brain cells. It's that serious.
Okay, so your alarm bells are ringing. You've got a high index of suspicion. Now what? You have to move fast, but you also have to be systematic. Let's walk through the diagnostic pathway to nail down the cause.
First thing, the very first thing you do is order a stat blood ammonia. This is non-negotiable. Don't wait for the CBC or the CRP to come back, and you gotta do it right. Get a good, free-flowing sample, put it on ice immediately, and walk it to the lab yourself if you have to. A poorly handled sample can give you a false reading, and you just can't afford that delay. Remember, time is brain.
All right, so the sample is on its way to the lab, but you're not just sitting around waiting. Your brain should already be churning through the differential diagnosis. Big picture, we're thinking, is this a primary problem, meaning a defect in the urea cycle itself, or is it secondary? Is some other metabolic mess, like an organic acidemia, causing the ammonia to back up? This is a huge fork in the road, and it's going to guide everything you do next. And hey, here's a really useful clinical pearl to help you sort that out. Just look at the clock. If the baby gets sick in the first 24 hours of life, you should be thinking more about secondary causes or maybe transient hyperammonemia in a preemie. But if they were fine for a day or two and then crashed, that really points you towards a primary urea cycle disorder that got unmasked once they started eating protein.
Okay, the lab calls back. The ammonia level is sky high. Now the clock isn't just ticking, it's screaming. It's time to act. Let's go through the acute management protocol you need to launch, like right now. And remember, you're probably getting a metabolic specialist on the phone as you're doing all this.
So here's your 4-step rapid response. Step 1, stop the poison. Cut off all protein intake immediately. No more breast milk, no more formula. Step 2, stop the body from making its own poison. You need to shut down catabolism. The best way to do that? Pump in high-calorie fluids, lots of glucose. We're talking a glucose infusion rate of over 10 milligrams per kilogram per minute. Step 3, supportive care. These babies are incredibly sick. They might need to be intubated. They might need bicarbonate for their acidosis. You stabilize them. And step 4, and this is huge, you start preparing to get that ammonia out of there, fast. So while all that's happening, you have to be thinking about the end game. How are we actually going to pull this stuff out of the blood? There are a few options for removing toxins, right? But what's the absolute best, most effective method for this specific emergency?
And the literature is crystal clear on this. You can see it here. Things like exchange transfusions or peritoneal dialysis, they're just not good enough. They're too slow. The gold standard, the undisputed champion for removing ammonia, is hemodialysis. It is by far the most effective way. So if you have a severe case, you need to be getting the wheels in motion for dialysis. And yeah, that often means getting on the phone and arranging an urgent transfer to a center that can do it.
All right, let's say you've navigated the crisis. The baby is stabilized. What happens next? Let's talk about the long-term prognosis and what the key takeaways are for your practice.
So the tough reality is that even with the best care, the risk of long-term neurologic problems it's pretty high. The final outcome really hinges on a few things: how severe the underlying genetic problem is, what the peak ammonia level was, and, this is the part we can actually control, how long that baby was in a coma. The duration of that hyperammonemic state is absolutely critical.
So if you take away just one single thing from all this, let it be this: speed matters. Your rapid recognition, your guts to call for that stat ammonia level, and how fast you act, that can literally change the entire trajectory of a child's life. It's that important.
And that brings me to my final question for you. Think about your own unit, your own hospital. How can you make this process faster? Do you have a clear hyperammonemia protocol? Does your lab team know exactly what to do with an iced sample that says stat? Does every single person on your team understand that a lethargic neonate is a code-level emergency? Because every minute you shave off that timeline, well, you're saving neurons, and that's what it's all that.